So I specialize in hip, knee, and shoulder surgery. I do have an area of interest in hip arthroscopy, which is a somewhat newer procedure that we have these days. You know, in the past, when someone had hip pain and they didn't have bad arthritis, they were told, well, either just live with the pain or go have a hip replacement. But now with the newer techniques, we're able to treat smaller tears in the hip, which are very painful. So it's a small procedure. It takes about an hour. We do it in a surgical center where you just come in the same day, leave the same day, maybe using a cane or crutches for a couple of weeks, and then patients are able to get back to their normal activities afterwards. I mean, I've had marathon runners that couldn't run a marathon, they went back to running a marathon. And to me, that's one of the most special parts about being an orthopedic surgeon, is being able to see someone get back to their activities, or even having someone who can't walk anymore, having be able to get back and walk. I mean, you see a whole transformation in patients. When you're in pain a lot, you're depressed, you're upset and everything, and then once the pain goes away, you're back to your happy self. So it's really special to see patients achieve those goals.